always disrupted. Your sleep is always disrupted, and you wake up feeling so tired, So this could also be as a result of the fluctuating levels of estrogen and progesterone. Another one is the increased risk of endometrial hyperplasia. Now, in women who still have a uterus, because in some cases, some women have had their uterus removed, maybe as a result of fibroids or, one thing or the other. It can also lead to a thickening or an excessive thickening of the uterine lining, which can increase the risk of endometrial cancer. Other things could be, high blood sugars. We mentioned earlier that estrogen actually can help to reduce the risk of type 2 diabetes. But imagine taking away that estrogen and having a reduction in the levels of estrogen, or in the case of the actual menopause where there's no estrogen being produced at all, then there's an increased risk of type 2 diabetes, high blood sugar, which is, high blood sugar, and also some breast symptoms and breast changes. So these are some of the things or some of the effects of the fluctuating levels of these hormones. And this is what some women will start to experience even in their, early to late 40s and above. And when the periods completely stop, so 12 months after that, that's when we call it the menopause. So these are some of the things that women face or women experience. And this is why, again, we're talking about it. So I would like to, this is a picture that just shows some of those symptoms that I mentioned. There are so many more symptoms and, things like electric shocks, fatigue, we mentioned, weight gain. Some women would only just start to feel palpitations. So their hearts are racing or their heart is beating so fast all the time. Sometimes it could be just night sweats that they get. Some people have just dry skin, or they have urinary symptoms where it just feels like they need to go to the toilet all the time. Or in some cases, when they laugh or sneeze, they're leaking urine. Some people is bloating. Before they were happy, they were okay eating, normal types of foods, but they notice that now they eat bread, they feel bloated, or they eat something like maybe rice or whatever, and they're just feeling very uncomfortable. The bowel habit starts to change. In some women, it's breast pain, just always experiencing breast tenderness. I have patients come to me, where they've had breast pain. There's no breast lumps, but they're just in pain all the time. These are very uncomfortable feelings. Some women, it will be, like I mentioned, the mood swings. Some, it will be headaches, just very increased frequency of headaches and migraines. Another common one is brain fog. I see this so many times where you have a woman who is in a very high, high pressure job, usually very able to talk and give presentations, but then she will just find that during the presentation, she has to just stop because she can't remember what she wanted to say. She can't remember the words. These are real issues that the women are suffering with. And in some cases, people don't even know that that's what it is. So they don't know who to turn to. They don't know what to, they just think they're going crazy because they have all the symptoms. For some women that come to me, they will say that they're scared of losing their jobs because they're now underperforming at work. And if their boss is a man or a male, they just don't understand. And even the woman herself might not understand what is going on with her. So I want to talk about this fictional case. But to be honest, I have so many women come or present with symptoms such as this. So I'm going to quickly read about Mrs. D. And then after, I'm going to ask the audience to just, again, raise their hands using the Zoom reaction to see if you can resonate with Mrs. D. Okay, so Mrs. D is a 46-year-old lady. She works as a bank manager, so she has quite a stressful job, but she's also a top person at that workplace. And then, she's just not been able to connect with her friends because she has so many symptoms or so many things going on with her. But this particular friend has been very persistent and said, we have to meet up for at least lunch. So she goes along, and the friend is asking, what's going on with you? You don't look like you're not like your usual self. You're usually very chatty, but you're so quiet. After a while, Mrs. D is just like, okay, let me open up to this woman, and tells her that, she's going through a lot. That, in fact, if she just laughs like this, she's leaking urine. She's going to the toilet a lot of times during the day. She doesn't even feel like having sex with her husband. She's not interested in anything. She's so embarrassed about this, but Mrs. D's friend is just, kind of listening to her. So she feels more comfortable sharing what she's going through. She says she's so forgetful now. She can't even remember things at work. She's forgetting things. She's forgetting to pack her children's lunch, lunch for school. She's very irritable, always shouting at her children. She's not sleeping well. So she wakes up feeling so tired. Again, her skin is dry. Her fingernails are breaking so easily. And then her period, so heavy. She can't even tell when her period is due because period is so irregular now, feeling very bloated. So she just opens up to this friend who must be a very close friend for her to share so much. And the friend is just thinking like, wow, what advice can I give? And that's what I'm here to talk to you about today, really. Now, is anybody here who has maybe gone through any of the symptoms, even if it's just three out of what Mrs. D is going through? It's a lot of symptoms, but it's so common among women. So please, using that reaction icon, if you can just, please don't feel embarrassed. We're here to learn. We're here to also take, knowledge is power. The knowledge that you get from here, hopefully will be shared. You can, help somebody else, just like Mrs. D's friend is going to help her. So please, I can see people in the comments saying yes, that they've had some of these experiences. Thank you so much for sharing that. You know, I train in the UK, and that's where I currently work. But most of my patients are Caucasian. I don't have any Black patients. And at one point I used to wonder, is it that Black women are not going through this? Because I'm not at that stage yet, but thank God with the knowledge I have, I know that when I get to that perimenopausal stage, I will have all the knowledge I need by God's grace to help me through it. So I used to just wonder. I asked my mom, she said she didn't really go through many. I asked my mother-in-law, she said joint pain was one of her main symptoms. But I'm really happy to see that people are sort of saying that, yes, they're going through it or they've gone through it before. So these are things that it's a normal part of life, this menopause. Everybody's going to go through it. But it's important for us not to be quiet about it because you don't know how you might be helping the next person who has kept it to themselves and just is just suffering in silence. There's no need to suffer in silence. We're here to learn about it and hopefully to share the information that we get here with other people. The more we talk about it, it's not because we're trying to medicalize it or make it a disease. It's not. It's just so that we can have information, we can know how to prepare for it. Because just like with starting periods, I remember when I was younger, before I started my period, my mom had talked to me about it and it really helped so that when I started, I knew what to expect. So that's what we're doing here, trying to share information so that if we're going through it personally, we know that we're not alone. It always helps when you know that you're not the only one that is suffering or you're not the only one that's going through all these things. What are some of the things that we can even do to help ourselves, to help us go through this? I think earlier I mentioned about heart disease and osteoporosis, because those are sort of two kind of top ones or top risk conditions that menopause can increase the risk of. So with heart disease, for example, if we know that lack of estrogen is going to increase that risk of cardiovascular disease, then already we can start to do things like watching our diet, eating healthier, and also exercising. Exercise is so important when it comes to heart health. Also checking your blood pressure, maybe just once a week or maybe once a month, because blood pressure being high, so high blood pressure is a big indicator that somebody could develop a stroke or a heart attack in the future. So it's always, I have my blood pressure machine. I bought one for my mom and dad just so that they're checking it regularly. So it's really important that we make sure that we're eating healthy, we're also exercising. Our next speaker will be talking a bit more about the diet, so I don't want to talk too much about it, but it's just really important as well. Somebody mentioned joint pain. Yes, joint pain is another, big one. In some cases, we're thinking, could it be arthritis? But it's not always arthritis. So it's always important to see your doctor if you're experiencing sort of joint pains. And one thing that can help with the diet part, when it comes to joint pain, is having a diet that has calcium. So making sure that you're eating or drinking, like for example, milk or dairy products that will give you the calcium that you need. Now, vitamin D is another thing, another source of help to protect our bones. Vitamin in places in Africa again, where it's quite sunny. I found that, you can get your vitamin D from there. But, I remember again growing up in Nigeria where if you have a driver, you're really in the car with AC, and then you don't really get to walk around in the sun. So please, if you're not getting vitamin D from the sun, if you're not spending enough time in the sun, then you need to take supplements, so vitamin D supplements, okay? 'Cause just because you live in a country, in a continent where there's plenty of sun, it doesn't mean that we're actually all getting that sunlight. So if you're not, then please take vitamin D tablets. Then earlier on, when I talked about Mrs. D, there were some other symptoms that she had, such as the heavy bleeding and then irregular bleeding. So that's something that you really need to see your doctor about, okay? Because it could be the perimenopause, but there are treatments or there are things that we can give you to help to reduce that heavy bleeding. Okay. HRT now. HRT is hormone replacement therapy. I'm going to talk about what we do here in the UK regarding HRT. It's when I was in medical school, HRT was sort of seen as something that was not very good because there was some research done showing that it increased the risk of breast cancer. But that research has now been disregarded, basically. And it is something that's really helping women because it replaces the levels of estrogen and progesterone that's declining. Okay. So it comes in different forms. So we have tablet form. It also comes as as a patch or gel. So it can be used in that way. Okay. So it can be used in that way. So those are some types of HRT that we have available. Okay. So HRT is usually what we prescribe. Somebody talking in the background. Can you please mute? Yes, thank you. So yeah, so I was talking about HRT. HRT is prescribed by medical professionals, and it all depends on a woman's past medical history. There's some people that might not be able to have HRT because they have medical conditions that prevent them from having it. But you have to talk to your doctor about it to see if you'll be eligible to have that. But I've had patients who have given HRT, and the way they talk about it is like everything has changed for them. They feel they're not as forgetful anymore. The joint pains have gone away. They don't feel as tired. So it seems to be working, at least for the people that I prescribed it for. Okay, but there's another thing that some people can have. For example, if you have a medical condition where you can't have HRT, there is vaginal estrogen. So for women who experience a lot of vaginal dryness or urinary symptoms where they're going to the toilet constantly, those kind of things, then sometimes I will prescribe vaginal estrogen, which they can use as a pessary to insert in the vagina. And that one has very low risks of any conditions or any medical risks. So it's something that I commonly prescribe as well to women just to help them with that. Now, going back to Mrs. D, we talked about the heavy periods. I just want to say what Mrs. D did eventually was she went to her friend told her to see a doctor. So she went to a doctor who then referred her to a menopause specialist. And I have to mention this because not all doctors know much about menopause. Okay. I'm not sure about the training in Nigeria, but in the UK, we probably got 1 hour of lecture on menopause. So it wasn't a lot. So I had to do a lot of research and postgraduate training just so I could be, considered a specialist in that area. So the reason why it's also important to talk about this is because you might go and see a doctor who maybe doesn't even know too much about menopause. It's always good for you yourself to be able to know the symptoms so that you can actually tell the doctor, I have all the symptoms, and yes, it might be other things because we mentioned anxiety, depression, even dry skin. Yes, it could be something that's related to something else. But let's say, for example, you've been to a doctor, they've done all the tests, they've done your blood pressure, your ECG, and everything is normal. And maybe they've even given you some treatment and the treatment didn't work. That should make you start to think, okay, actually, doctor, what if it's my hormones? And sometimes I have patients come to me where we've tried different things. And then they say, what if it's hormones? And even me, I'm like, yes, very likely it could be hormones. Let's, take another look at it. Because there was a time when we used to prescribe antidepressants. So somebody's written SSRIs in the comments. And even in the UK, somebody will come with menopause symptoms and we just give them antidepressants because they mentioned that they feel anxious or they feel low in mood. And then it helps their anxiety and their low mood, but they still have those other symptoms that we mentioned about. And that's why you really you needed somebody who has an idea of all the different symptoms of menopause, because some people come with some very strange symptoms. And if you treat it by itself, you will end up giving them antipsychotic medication or other kind of medication that actually the bottom line was that they were going through perimenopause and all they needed was maybe some advice, some holistic advice about menopause and maybe eventually HRT. Okay, so in this particular scenario, Mrs. D gets referred by her doctor to a menopause specialist who knows what they're doing. And then they prescribe HRT for her and they also prescribe some vaginal estrogen because in her case, even though some of her symptoms could have been urinary tract infections. Let's assume that Mrs. D actually had antibiotics for that, but it kept coming back. And every time they will send a urine sample, there will be no infection found. So we can see that sometimes, even though you have urinary symptoms or you have other symptoms of menopause, if you've gone down the route and you've had all those tests and even all those treatments and they haven't worked, let's start to consider that it could be perimenopause. Somebody's mentioned that HRT is not really readily available in Nigeria. And that's why I was mentioning that I was trying to talk more about the UK, but I don't know how you can get HRT in Nigeria. What I would hope is that you speak to a healthcare professional or a doctor, or, in Nigeria first about your symptoms, and then hopefully they can either refer you, look at what Debo Africa is doing. Maybe they can refer you to a specialist in women's health, and then we can start from that. Now, we'll take some of the questions at the end, but I just want to talk about one other thing that Mrs. D had done. Her doctor gave her or inserted a progesterone IUS, which is like a coil, the family planning coil or the contraceptive that you use, which can help. Over here in the UK, it's one of our first line treatments for managing women that have heavy periods. We insert a coil. That's something that I do at my practice, and it really can help to regulate her period, because even the HRT itself will not help to manage her heavy period. So she needed something else that was meant for that. She was also referred to a dietitian who offered her dietary advice. Mrs. D started to exercise often, started to eat healthy. She was also taking her multivitamins. And within about 6 months, she was back to her normal self. Her relationship with her husband was better. She was sleeping better, very joyful. And the key thing is that she was very happy that she opened up to her friend about her struggles, because if you don't say anything and you just suffer in silence, you're going to assume that there's no treatment for what you're going through and nobody can help you. So the main thing is to be able to open up to somebody, a trusted person, or even see your doctor, even if it's just the sleeping problem you're having or the low mood that you're experiencing, whatever it is. I think when you share a problem with someone that's trusted or a healthcare professional, even if that healthcare professional doesn't know much about menopause, because you have attended this talk today, because maybe your friend comes to you, you can explain some of these things to them and say, you know what, when you go back to your doctor, just ask them, could it be my hormones? Could it be my the lack of estrogen that I'm experiencing? That will put that in the doctor's head too, so that the doctor can start to think about it. We're all for advocating for yourselves. We need to be advocates for ourselves and for our family members. Thank you so much for listening.
Thank you so much, Dr. Anu. That was a very, very enlightening session. And one of the symptoms you said, so I'm a doctor myself, and first about the HRT, yes, HRT really gets a bad rap. You're very right. And I remember in medical school as well, you would hear about the increase. One of the risk factors for breast cancer is usually women on hormone replacement therapy. So it was enlightening to know that at the moment, it has been debunked that HRT doesn't, apparently that is not linked to breast cancer, as you said. So that's new information for me. Also, I feel like when we hear about menopause, we tend to think that it's a topic for just women. But you mentioned, like with something like the mood swings, for instance, I think it's important for men, the partners of those women and their children to also be aware of of the symptoms of menopause, like mood swings. So that way you're able to give your mother grace, you're able to give your partner grace as well when they are being irritable and, experiencing the mood swings. So thank you so much for your presentation. So if you have any questions for Dr. Anu, please just put in the chat box, and during our Q&A segment, we're going to take your questions. So our next speaker is Dr. Rametu Momodu. She's going to be taking us through how to support women through menopause. As I said, menopause is not just a topic for women, it's a topic for people who haven't reached menopause yet, so that when we start to experience the symptoms, we'll be aware, and also so that we can give grace to our mothers, to our partners as well. So she'll be taking us through coping strategies for menopause as women, and also how to support our loved ones going through menopause. So Dr. Rametu Momodu is a pharmacy graduate of the University of Benin. She's an avid reader and she has a PhD in clinical pharmacy. So that's where her doctor is from. She's a doctor of pharmacy. She's a triple fellow of the Pharmaceutical Society of Nigeria. She's a fellow of the West African Postgraduate College of Pharmacy. She's also a fellow of the Nigerian Institute of Management, and she continues to raise the bar in excellence, working with NAFDAC, and she rose through the ranks, making significant contributions to the agency, and she's now a director at NAFDAC. So we're going to have Dr. Rametu up next to take us through the coping strategies for menopause.
Thank you very much, Dr. Okay, yes, I'm unmuted. Thank you very much, Dr. Egbeyemi, for the introduction. And I want to say a special thank you to Debo for creating this webinar for awareness. And as I said earlier when we were talking, we don't talk about menopause enough. And so this is an avenue to talk about it. So I'm really grateful, and I'm sure a lot of people are going to benefit from me today. So thank you, Debo Africa, for everything that you do. So I'll be talking about the coping strategies because for me, it was a unique thing. I didn't prepare for it at all. And I'm hoping that with what we're doing now, with what Debo Africa is doing, that we'll be able to pass the message out there, destigmatize menopause, and for everyone to recognize that it is the normal course of life for a woman. Can I have the next slide, please? Okay, so thank you, Dr. Anu, for the exposition you gave on the different symptoms and the definitions, what perimenopause is and what menopause is. I am talking about the coping strategies, so I will try to address the different symptoms, and I might talk about some symptoms that you did not really expand on. For hot flashes and night sweats, what you should do is, so I usually would have a bottle of cold water around me. Even at night, I keep it around me, just to have that cool thing when I get to that hot flash. But I mean, if you can't stand cold water, you can take room temperature or anyone, but just some fluid because it helps. And another thing you can do is layering of clothes, because beyond the hot flash, there are also sometimes for some people, it comes with what I would call the cold flash. So you have a hot flash, 1 minute you're hot, then the next you're very cold. So layering your clothes helps. You can take off a piece at a time, depending on what you're feeling at that time. Then you can use cooling products like fans and pillows or cooling sprays, and then avoid triggers. For that, you need to watch yourself. You need to know what triggers your hot flashes. For me, yes, indeed, spicy foods, caffeine, hot beverages, I mean, even beyond these, even emotions. If I'm very emotional, maybe somebody did something that I'm upset with or something that I don't like, I have noticed in recent times that I feel that I would get a hot flash. And the reverse now is also the case, even when it's a joyous news. So in other words, it means anything that disturbs the equilibrium causes a hot flash. So it's important that as women going through this phase, that we're conscious of our emotions, that we're conscious of our body, because every woman, as our phrases are different, so we react differently to menopause. Everybody goes through it in a different way. But these are just some strategies that will help for whatever it is that you're going through, whatever symptoms that you get. And so you need to watch that for yourself. I mean, I noticed this in recent times. If I'm happy, sometimes I even have the hot flashes. If I'm unhappy or something happens, I have the hot flashes. So you need to watch that for yourself. Avoid caffeine and meals close to bedtime. Until recently, I didn't have any problems with meals close to bedtime, but I had in the past 6 weeks, if I take a meal after 6 o'clock or 7, it gives me, I will not be able to sleep at night. So you need to, again, as I said, you need to watch your body. You are your best doctor, because you need to know what it is that causes those symptoms that aggravates the menopausal symptoms. Vaginal dryness, I won't talk about that because Dr. Anu has spoken extensively on that. Prescription as vaginal estrogen therapy, she has also spoken about that. And someone was asking in the chat box, yes, they are available in some pharmacies around here. Maybe if, I mean, we can speak with Deborah, we can give you some pharmacies that you can contact on WhatsApp, that you can, or go to their website. They can get all of this to you in your home. Here, engage in sexual activity regularly to maintain vaginal elasticity and lubrication. Yes, it's important if you have a partner for that. And then you should also consider alternative therapies, just as Dr. Anu has mentioned. Next slide, please. Bone density, we talked about vitamin D, and also eating a meal that is calcium rich. I know we don't have a lot of that in Lagos. I mean, I live in Lagos, so when I speak, I'm speaking about Lagos. But if you live around Jos, the cruciferous vegetables like okay, so this is brain fog, but I will remember and I will let you know. Then the other pelvic exercises to improve bladder control. Yes, this is important, and to reduce urinary symptoms. Because, I mean, I was speaking with a group of friends recently, and we were laughing at each other that previously we could hold our urine for as long as we wanted to. But right now, once you want to go, you have to go. And in fact, if you're not careful, before you get to the restroom, you're already dripping. I just want to say that if you're experiencing that, don't feel stigmatized. It's not something that you should feel ashamed about, because it's helping a lot of people. And what we're talking here today is really to validate some of those things that people are feeling. We were speaking earlier on before we came on the show, and I was saying there are some symptoms that I had experienced, and I know some other people had experienced. So, for example, you might, it might be anxiety, even beyond anxiety, paranoia. You're afraid of people. You think everybody is against you. You think you don't understand what is going on. But like we're saying today, most of these symptoms are, I mean, if you're in this age bracket, you need to consider first and foremost that it's because of the hormonal changes that you're going through. You know, in this environment, because of our faith, because of some of the things we believe, you might think that, oh, somebody has it in for you. In fact, the one about night sweats, I remember that when it started, that exactly was my first thought. I mean, I would have night sweats, and then I would have the muscle tension in my legs. It would be so bad. I'll be so uncomfortable. My heart is beating. I'm so afraid. I remember one night, I even actually called my friend because I couldn't sleep. I was so afraid. If I thought I would die, that I would not make it through the morning. So exactly that village people are after you. So I spoke with her, and she said, oh no, that she had gone through all of this before. And, you know, when you know that someone else has gone through it, and that your problem is not just you, or that those symptoms are not just for you, it helps you to feel better. It helps to validate you. And you know, okay, that this is not village people. This is not, it's not that they are coming after me, because I actually had someone, when I was having some of these symptoms, tell me, oh, that they are coming after you. You need to pray. You need to do this. Oh, yes, there's a place for prayer, even in all of this. I was doing all of that, but I just want to reassure some people today that you might be going through some strange symptoms. I mean, some symptoms were listed when Dr. Anu was speaking, but I have seen a particular video where they listed over 100 symptoms. And I can tell you, at some point or another, I have felt almost 70 of those. And they come from anxiety, your heart is beating, you're fearful, you're all kinds of things. Your body is aching, the night sweats, you have headaches. No matter what you do, the headaches will not go, you know. But just to say that these are all menopause symptoms. There's nothing to be afraid of. And we're saying today, be comfortable with it. speak to your healthcare professional. And some of the strategies, the first thing is to speak to your healthcare professionals. Yes, there are other things we can do. For headaches, you can take Tylenol if it helps. I remember there was one time I was using a body care a lot for my leg because they just used to ache, and my knees, they just used to ache. But again, I would not want to talk about drugs here. I would stick with the natural products. There are a lot of herbal products that have been recommended and they work. But a caveat, they might not work for you, or some might work for others and it might not work for you. Red clover is good, it works. Evening primrose, it works. Black cohosh, I bought all of these and I had some sort of relief. Black cohosh may help to reduce hot flashes and improve your mood, while the soy isoflavonoids provide relief from hot flashes and vaginal dryness. But as I said, I will keep saying this, it is important to consult your healthcare provider before starting supplement, because if you're using other drugs, they might react. And if your blood pressure is going up because you're not sleeping well, they might need to recommend antihypertensives for you. So it's important that you see your healthcare provider. Can we have the next slide? Another supplement that I would like to talk about is magnesium. I have found that magnesium is very, very important during this period. But the magnesium you should take is magnesium glycinate or the neuromag, because it helps your sleep, it helps to relax the muscles, it just helps your overall mood. So as menopausal women or perimenopausal, make sure you have magnesium around you. It's really going to help. You take it at night, it will help you to sleep and to relax your muscles. Your lifestyle will definitely change. Just keep this in mind. Just embrace it. I'm saying embrace it because I also struggled with it. I wanted to eat what I wanted to eat, but I found that as I eat things that contain sugar, I have hot flashes. So after a while, I had to stop. I love ice cream, but I had to stop eating ice cream. So if there are things that you have noticed over time that as you take them, you get a hot flash, you need to keep a diary, which is what we were saying in the beginning. You need to be your own doctor. Keep a diary. What did I eat today that disturbed my sleep? What was it that I took that caused a hot flash? I have had to do this. As I said, that's why I know that from 6 weeks ago, I can't eat a high caloric meal after 6 o'clock because I will suffer for it at night. I will not sleep. And for those who take alcohol, if you take alcohol at night in the evenings, it means you're not going to sleep that night. So I mean, if you need to take alcohol for whatever reason, try to do it earlier, because if you do it late, it will disturb your sleep. I cannot overemphasize the importance of exercise. I've been one who exercises a lot, and we have articles, medical articles that have shown us, and even from experience, that exercise helps a lot. Even as you're feeling the pain, you're feeling weak, you're feeling tired, try to do some form of exercise. It can be walking, it can be running, not so much because you don't want to fall or break bones or anything, but just do some form of exercise, do stretches. And then it's very important to do strength exercises because we need to strengthen our muscles at this time. Try to do 150 minutes of exercises in a week. That's on the average about 30 minutes. If you're able to break it into small bits, it helps a lot. I tried to do that and I found that it helps a lot. It helps even with the pain, it helps with the sleeping, and it helps with movement, because there was a time sometimes to get out of bed, I will feel so stiff, but I found that exercising frequently helps with that. So it's important to do that. Eat calcium rich foods, yes, aim for 150 minutes and incorporate strength exercises. And I'm going to say this, there are a lot of women who, as we grow up, as people who have weight and they're more concerned about losing weight. I'm not saying don't be concerned about losing weight. It's good to have it to be a fair size. But what is most important really is to build strength. If you build strength, You build strength. So you should do strength exercises to build your strength. You should lose weight because you don't want to put so much on your heart. You remember during Dr. Anu's presentation, she mentioned that the lack of estrogen and progesterone, what it does to the heart, and we really want to protect our heart. So it's important that we do strength exercises to protect our heart and also strength exercises to build our muscle. Yes, the ways to provide support, education, just like we're doing right now. And then you can go, there's so many sites right now talking about menopause. They say knowledge is power. Empower yourself so that you can help yourself as a woman. And if there are any men on this call, so that you can help your loved ones, you can support your wife during this season of her life where she's going through menopause, because it's very important. I remember when this was happening to me in the beginning, I didn't know what was going on. And I mean, apart from my husband, there was just so many people around who were irritating me, and everybody was saying, you get easily you're irritable, you get easily irritated. But I mean, I wish I had the education and I had known that this was what I was going through. But as soon as I found out, I made sure everybody around me, at every point in time, I'm telling them, please, this is menopause going on here. Go and read up on it because you need to provide us support. There are different ways people can provide you with support. It might be just helping with chores. So, I mean, if you're a guy or if you're a woman, your friend is going through it, just lend a hand. And remember again, your body is going to change as a woman when you're going through menopause. You're going to start losing hair. Your nails will be brittle, so you're going to have issues with your nails. This is a time where it's almost like you need to give back to your body. What your body has given you in the last 45 or 50 years, you actually need to take care of it right now. I know my hair was falling. I read up on it. You use aloe vera, use oils to condition your hair. Even the front that had fallen off, I have it all back right now. It's very important to do that. Your skin will be dry, as has been mentioned before. So you have to pay attention to your skin. You're going to use, you have to moisturize. It's very important that you moisturize. It's very important that you take in a lot of fluids. Your fluid intake. In fact, I always have a water bottle. Even as I'm sitting right now, I have a flask of water. I have a water bottle. I mean, some people count, they say is eight glasses a day, but I just say just consume as much as you can consume. And drink water, not because you're thirsty. Drink because you have to drink water. So if we try to do that, it helps a lot. Then another way people can support women who are going through menopause is through empathy and validation. And as I said, when you know the symptoms and we talk about it, it helps to validate some people. The issue I said about waking up at night and wondering what was happening, I mean, just hearing another person say, oh, I have gone through this was a lot of validation for me. And I said, okay, so I'm not going to die and I'm not the only one going through this. And we need to, as we support other women who are going through this, let's the support, I mean, apart from education, we need to encourage them. We need to share as much information as we can, help them, I mean, in practical things, whether it's with childcare, whether it's, I mean, if they have something to do, you help them, you know, things like that. That's really helps. And then workshops and seminars like this or community events to raise awareness and menopause, we need to do that and utilize. I belong to, I think is one. I belong to one platform where we talk about menopause. So from time to time, if you find anything on menopause that helps, we put it there, whether it's a strategy or a new symptom or something. And all of this, when we are involved, when we're educated, it really helps. The diet, I cannot say that, you know, my diet has changed completely. It's very important that you take care of your diet. Your lifestyle is going to change. You have to do exercises. You have to take the supplements that are important. You have to, I will share what the group is. And so I'll share it with Debo so you can all join, whoever is interested. So it's very important that we do all of these. And beyond this, we need to do self-care. Okay, so prioritize self-care. Because as women, more often than not, we're more interested in, we have to take care of our husband, we have to take care of the home, we have our job, we have our businesses, we have church, or we have mosque, we have faith-based activities that we need to do. But recognize that this is a season where even as you're doing all of this, you need to take care of yourself. You need to reduce your stress, because I found that for me, stress was a trigger, was a very bad trigger. And there are articles to back that up, to scientific articles. So you have to, as much as possible, get out of stress, do activities that are fun. And also you can get into meditation, or get into meditation, have quiet times where you're by yourself and doing your own thing. Chibat, you're moving my slides up. Okay, so yes. Now, regular screening. No, let's go to the one about regular screening. I cannot overemphasize the importance of regular health screenings. I think since I started this journey about 3 or 4 years ago, almost every month, doing some form of screening or the other. I think initially it was out of a lack of knowledge, because I mean, I didn't know what was happening in my body. I would go, they would check everything and they would say everything is okay, until I realize and I embrace the fact that I'm in perimenopause and going into menopause. But it's very important. It's very important to do your health screening. Do as frequently as you can and as you can afford. I know that Devil Africa usually has all kinds of discounts, and it's a place for women because they understand that some people are shy, some people are very private, but I mean, they provide a good platform for this. So I would recommend that you can go for your screenings there. I have been doing a lot of screenings until recently, when I understood what was going on. And even beyond that, even when you understand, you need to check your thyroid, you need to check your sugar, you need to check your blood pressure. Yes, Dr. Anu mentioned blood pressure. I think it's very important that we all buy the stats blood pressure machine and the kits for checking blood sugar, because these are the ones that just creep on you without knowing. They just creep on you and they get high with no sign. So it's very important that we do this. And having said this, there's something I want to talk about. Many times, many of us, especially in this part of the world, we have helps. We have nannies or housekeepers who are also in their 50s. But many times we don't remember that these same symptoms that we have, this same menopause or perimenopause that we're going through, they are also going through it, and we don't provide the care that they need. In recent times, between last year and now, I know about 4 housekeepers, let me call them that, who have died. One died of a heart attack. I mean, she even just died suddenly. Another one, it was a heart attack too, but apparently her blood pressure had been going up and it wasn't properly managed. And you know, like that. So what am I saying? I'm saying that as women, we need to pay attention to the women who work for us, who are in this age bracket, because they do not have the resources that we have. And they might not even complain when they have these symptoms because they think it's just a natural part of life, or they cannot afford screening, they cannot afford to pay for the medicines or for to buy the supplements that they need. So my charge to us here today is, let's pay attention to these people. If you have a housekeeper that is over 50, you need to be checking her blood pressure. You need to check her blood pressure. You need to check her sugar. I mean, many times they do a lot of work and they don't recognize that there's stress going on. We need to help them in a way that they can also have a quality life, you know, because we only think they go through exactly what we're going through because they are women. But so it's important to mention this, that as we're taking care of ourselves, we also take care of our housekeepers. Do the health screenings for them, even the minimal ones. Check the blood pressure, because that's really the greatest culprit. Because if she's not sleeping well, the blood pressure is going to go up. With the protection of estrogen and progesterone not there, everything can just go haywire. Next slide. I think I've said we're already at 12 o'clock. So in conclusion, it's a natural phase of women's life, marking the end of the reproductive years. Next slide. Okay, things to note. Yes, it brings about physical and emotional changes, but when we understand the transitions, we are able to adopt proactive strategies and management that can enhance our quality of life. We should self-prioritize, seek support, and we should also support others on how to navigate perimenopause and menopause. Take whatever supplements, do your exercises, change your nutrition. Your nutrition will have to change. It will change because you have to reduce sugar, you have to reduce salt, you have to reduce oils. Remember, Dr. Anu mentioned the one about, I think she mentioned, but during menopause, your LDL goes up, the bad oils goes up. So you need to make sure that you're doing checks, your health screening to check all of these. And also you must reduce oil, salt from your meals. It's very important. I usually crack a joke. There's something we call grandma's diet, because from whenever my mom has taken oil out of her food, she eats very few. She eats a diet, or a low carb diet, low oil fat diet, and low salt diet. And that is what I would recommend for everyone. I was going to say unfortunately, but that's where I am right now. I didn't like that diet, but that is a diet that I find works for me. And I would want to encourage everybody to look into this. And just remember that menopause is a phase of life. It's not life-threatening like that. If you apply the right strategies and you're proactive, your quality of life will not change significantly. And you'll also be able to educate others on what to do as they're going through this phase. And well, yes, as a last word, consult your healthcare provider, do the screening checks, exercise, work on your nutrition. Thank you very much.
Thank you so much, Dr. Rametu. This was a very, very good one. Like, this was excellent. And I'm happy we, like, this whole webinar, we had a mix. We had a perspective from a doctor and a perspective from a pharmacist as well. Learning about the supplements, especially. This is not something you're really taught in medical school. So I was happy to hear about magnesium, especially. That one really resonated with me. And as you said, magnesium is very helpful. It was also nice to hear your perspective as someone who is going through menopause as well. That was very, very enlightening and helpful to hear, because it's usually helpful to hear firsthand about people who are going through that experience. So that way people feel like they're not alone. So it was very nice to hear your perspective. And then what you also said about community as well, and then the importance of health screenings as well. Those were very important aspects you spoke about. Thank you very, very much for your contribution. If anyone has any question, please kindly raise your hand before we go on to the chat box to address more questions as well.
Can I answer? Somebody is asking what type of magnesium. So magnesium stearate, magnesium glycinate, I'll put it in the chat box, magnesium glycinate and neuromagnesium. I should have brought mine. I have mine upstairs. So those two help because the absorption profile is better. The neuromagnesium actually passes the blood-brain barrier, so it really helps you. So it helps to relax the body. It promotes sleep. So it's one that you can get. But actually, any magnesium, I've used different kinds of magnesium and it works. Can I say one more thing? Please don't forget vitamin D. Vitamin D. Yeah. I don't know if I mentioned before. Yes, but I know Dr. Anu was talking about it from some, but it's very important to have vitamin D. Yes. Thank you.
Thank you so much. So we have a question like Gioni S11 is raising their hand up. Need to unmute them.
Good afternoon, Madam. God bless you for this presentation. We are very grateful, ma'am. So I just want to ask question on calcium. I want to find out, as it was said that calcium is very important to us, but all through the presentation, I was hearing that it's good you take calcium in your food. Are we saying that it is not good that we take it as a supplement?
Okay, so I think this is for Dr. Rametu. So Dr. Rametu,
Oh,
please, you get the
yes,
question.
yes, you can take it as a supplement. Yes, I took calcium for a while and then I stopped. You can take it as a supplement, definitely. Because you might not be able to get enough from your milk. Because for me too, again, what has come with menopause is I've become almost lactose intolerant. So I take non-dairy creamier. You know, like I said, this thing affects a lot of things, a lot. So there might be things that you're going through or things that are happening you don't understand. I was in the US last year around July, and I decided to just go somewhere and have a meal. And they brought, and I wanted a milkshake. And so he's just telling me that my age, I shouldn't be having milkshakes. And the whole day, as soon as I got back to my hotel room, I was in the toilet. I mean, I could hardly stand. That's how bad it was. I became lactose intolerant. I have never been lactose intolerant. So right now I have made a change. I'm not doing non-dairy creamier. So just keep, that's why I said you need to listen to your body. This is a season for you to help your body. You are your number one doctor. Because you remember what Dr. Anu said, when the doctors have checked everything and you're with them, tell them, can you just check my hormones? Check my hormones, see if they're in the right place. In fact, I have a prime example. When Oprah said there was a time her heart was beating fast, she was anxious and everything. And she's like, I do not have a problem. There's nothing. She had anxiety and all was going on. She didn't know what was going on. And every doctor, she said, they would do all the checks and say, there's nothing wrong with you, Oprah. And you know, Oprah is free, so she should have gone to the best of the best of the best doctors. It was, I think, by the sixth doctor that somebody said, how old are you, Oprah? And she goes, 51 or 52, I can't remember. And he goes, oh, we need to check your hormones. You might be in perimenopause. And then they checked, and guess what? Her hormones, her estrogen and progesterone had gone. Do you understand? So, as Dr. Anu said, after you have seen several doctors, tell them, please check my hormonal level. Maybe that is menopause that is going on here. And that's how she got on HRT. So, you know, this whole discourse about HRT, she and Michelle Obama are championing it. If you Google, check online, there are there's a video, and if I can find it, maybe I'll send it to Debo Africa and they can share. They talked about it, and yeah, I did HRT for a bit, but I have to admit I was a bit afraid, so I stopped. But again, because I was getting it from the US, it was very expensive, and then I don't have the full support here. So I think that's a discussion we need to have again, because most people I know have gotten HRT either got from the UK or got from the US. So Deva Africa, there's a gap for you to look after.
Thank you so much, Ma. So before we go on to the chat box, does anyone still have any question? Please kindly raise your hand up. We have a couple of questions to address in the chat box. So I'll just give 1 minute for anyone to raise their hands up. Okay, I think that's it with regards to raising your hands up. Okay, so we have some questions in the chat box. So someone is asking if menopause can affect your gut. I think it was addressed in the chat box, but I'm not sure if it wasn't really elaborated on. So this would be for Dr. Anu. Please, can you kindly answer if menopause can affect our guts?
So yes, it can. And some of the symptoms, and it's basically because of the fluctuating levels of estrogen and also progesterone, but particularly estrogen. So, and with women who are going through perimenopause, we've said that the levels are still fluctuating, so it can be up and down. So that's why you might start to experience changes in your gut health. And the majority of symptoms seem to be like irritable bowel syndrome kind of symptoms. So abdominal pain, fluctuation between sometimes feeling constipated, sometimes having very loose stools like diarrhea, and also bloating. So those are very, very common symptoms that I see. Again, you come to the doctor, we don't want to just say, oh, it's definitely menopause. So we'll run some tests and then even send stool samples off and things like that, just to rule out other things. And a lot of times we come to the conclusion that it's very likely that it is as a result of the hormones, because we know that it's expected. So it's really about, just like Dr. Ramato has said, it's about really knowing your body, identifying that something has changed. Again, you might go to a doctor, they've done all the tests and they don't find anything. So always remember to say, could it be my hormones? Because if it is, and if we think that is what is going on, it's really about trying to manage your diet. So you might have been, again, thank God we have somebody, Dr. Ramato, who is also going through this. So she's been able to identify what's going on, what's different, what's changed. You might have to stop some things. So even if you were not lactose intolerant before, if you're now going through this and you're experiencing, symptoms every time you take certain foods, you might have to make those changes.
There's a question. Can I answer it? It says,
Yes,
does it
ma'am.
affect skin patches, pigmentation? Absolutely. So let me tell you. Before I even knew I was going into when I was in perimenopause, before menopause, I did not have one spot on my face, not one. I'm those guys. I have a friend who always used to tell me, gosh, your skin is so beautiful. She was like, you don't do skincare, because she's older than I am. She's 4 years old. She always used to say, do skincare. Do skincare. Please, 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 please. I don't need it, and everything. I would just go to sleep, do everything, and then I hit 51. Oh my goodness. I had all kinds of breakouts, and then I had hirsuts, all kinds of things. My skin, I started having patches. So right now, I'm the queen of skincare. So yes, it does affect your skin. It gives you patches, pigmentation. You really have to do a lot of work. Keep your skin clean, cleansing. Don't leave makeup on. You have to moisturize a lot, because you're going to have all the dryness, because you don't have the cover of estrogen anymore. You're going to have your under eye dry, here, everywhere. So you need to get a good moisturizer. You have to cleanse your face properly. And I'm not saying go to these people, these so-called organic products. You have to be careful. I'm wary of them. I still buy I still do the Clinique range. So be careful with that. Yes, it causes pigmentation. You have to work on your skin, like literally now. You have to.
Yes.
No, there's
thank you
nothing
so much, Ma.
biologically
That's
wrong.
very helpful.
There's something, there's a
So
chart
someone
there.
That's okay. Okay, Ma. Someone asked if vaginal estrogen treatment is readily available in Nigeria. So that's for you, Ma, Dr. Rameto. Is there
If it's
vaginal
readily,
estrogen treatment readily
estrogen.
available?
Yes, I mean,
Yes,
if
ma.
you, yes,
Yes,
I
vaginal.
think I can. Yeah, I can look for it. I can look for it for you. I'll ask my friends. So you can give them
Friends,
my
okay.
contacts. I would, of Pharma Advantage, they have something medicines. I'll get the link and send it that to Debo Africa, or if you send them to me, I can give them that link so that they can get it. It's available. But even KY jelly helps during, if you know you're going to have intercourse or something, even KY jelly helps. So you should use that.
So someone asked, I think you've addressed that, Ma. Some of the symptoms of menopause, like hot flashes, is it biologically okay for women to experience this, or something is biologically wrong? I think this was addressed by Dr. Anu in the beginning, about the biological basis for hot flashes, like the drop in estrogen and progesterone levels already. But I don't know if Dr. Anu, do you want to elaborate, or is that okay with you?
Yes, so it does. It's not like there's something wrong with the person. It's because of the fluctuating levels. So yes, those symptoms are normal parts of the menopause.
Then someone asked, are the remedies suggested also for postmenopausal women? So Dr. Rameto, over to you, Ma.
Sorry, I missed that because I'm reading a chat here. I would answer.
Okay.
If you remember our pre-meeting, I said I had some guys who wanted to join. So
Yeah.
one is complaining now that admin removed him.
Oh,
I don't know.
I'm
He said,
not
will you
sure
please
why.
share your slides? Admin removed me. Maybe they don't want a man. My video and voice was muted. I don't think I broke any rule. Okay, well, maybe you can share. Yes, so please, what was the question again?
Yeah, so someone asked, are the remedies you suggested also for postmenopausal women? So probably women in their 60s, 70s, women who have gone through, oh, yes, postmenopausal
Oh,
women.
yes. Oh, yes, definitely. They are. They are. I'm 50. Like I said, I'll be 55 in 4 days. And these are some of the remedies I'm using. I did HRT for almost a year. But like I said, it worked. It helped. I mean, my body felt like I was 30 years old again. But, the doctors in the US had warned me that there was a 25% chance. And because I don't live in the US, they're not very comfortable. What else again? Because I had to be coming for checks, and that in 5 years, the risk of cancer doubles. All of that time, I said, "But let me respect myself and use all these other strategies. If I have hot flashes, I always have a towel around me. If I drink cold water, and sometimes I do the SSRIs. So, and then I just avoid the triggers, sweet things, hot carb meals. I just avoid them. So it's a whole lifestyle change, actually.
Okay, thank you, Ma. Okay, so time is fast spent. So we'll just take a few more questions. So someone is asking how to manage weight gain, even when you're not really eating, exercising, and all that. I think that goes back to checking your hormonal levels. Sounds like an hormonal imbalance problem. So that's from Abimbola. So it'd be nice to have your annual health check done and check your hormone levels as well. Can do that with Debo Africa. Yes. Then
And nutrition too. They need to mind their nutrition. Because one thing that happens during menopause is there's a redistribution of fats. I've never really had a big tummy, and well, you don't, but I'm slim. Well, I don't know. Well, I'm slim. I'm not that big, but I noticed maybe in the past 1.5 years, my stomach started increasing for no reason. Do you understand? So, yes, it started increasing. So you must watch your diet. You have to do veggies more. Half of your plate needs to be veggies. Your carb will be quarter of your plate, and then the other quarter is protein. Like I said, it's a whole lifestyle change. And then you must do your exercises, do your sit-ups, you just have to. Whether you like exercises or not, right now, your body doesn't care. You need to exercise if you want a decent quality of life.
Yes. Okay, thank you so much, Ma. So someone is asking for a summary of the supplements needed. So I think that's when we share this slide. But I think off the top of my head, vitamin D was mentioned, magnesium glycinate as well, or neuromagnesium.
Or neuromagnesium, yes.
And evening primrose oil.
Yes, evening primrose, yes.
And black cohosh.
Black cohosh, yes. And then soy milk.
Soy as well.
Yes, soy helps a bit,
It's okay.
Yes.
Someone is asking, does it affect the eyes? Because I observed I have blurry vision.
That might be your sugar.
Sugar, okay.
And also your gut. Sorry, I seem to be butting in.
No problem.
So let me tell you, 2 years ago, oh no, my experience with menopause has not been funny. 2 years ago, it was exactly 2 years ago, just before my birthday, and I wanted to do a photo shoot. But 2 months prior to that, I'd had red eyes. I have the pictures. I mean, I can share them for no reason. I saw about 8 doctors. I was in Kaduna then. I went to the eye center, and the National Eye Center is in Kaduna, and they have the best facilities for eye checks. They checked everything. I saw 2 other doctors because I was there. They checked everything. I came here. I saw 2 doctors in Lagos. Then I went to the eye center, the Guinness Eye Center in there. I'm just trying to tell you, I did everything I could do.
Yeah.
And nothing worked. They checked and they're like, Madam, everything is okay. But I spoke to somebody who does integrative medicine, which means they do herbs and give you all of those things. He just looked at me. He said, I didn't even say anything. He said, this problem is from your guts. I said, what do you mean it's from my guts? So I'm telling you. He said, don't worry, I'll give you some herbs. You drink it as tea and everything. And I tell you, 48 hours, this will clear. Do you know that's what happened? In 48 hours, oh yes. Wow, yes. In 48 hours, it cleared. It cleared completely. So your gut is really important, and You're going to have all kinds of strange symptoms that you don't know, but just know that if you're in that phase, most of this is menopause. They are menopausal symptoms, yeah.
Can I add something
Thank
as
you
well?
so much.
So
Yes.
because yes, menopause can affect the eyes as well, but please always also seek, just like Dr. Ramatu mentioned, she did see some doctors. It'll be good to just check it out just to make sure that we're ruling other things out. But yes, it can happen in the menopause.
Yes. Okay. Thank you so much. So we're just going to take one last question because time is really, really fast spent. So, Dr. Anu, is there a relationship between high cortisol and menopause?
So yes. So what tends to happen again, because of that imbalance in or the fluctuating levels of hormones, it can also impact the cortisol levels as well. So basically cortisol is what we call the stress hormone. So we can notice that there are higher levels. So it's very important, because the things that we need to do to balance that out would be trying to be more mindful, trying to reduce stress, trying to make sure we take time, time out to relax, go on retreats and things like that, just to reduce those levels. Okay. But if somebody's experiencing any symptoms of that, please always go to see a doctor. They can even check your cortisol levels as well in a blood test. Okay. So that it can be managed appropriately.
Okay, so thank you very, very, very much. Does anyone have any questions they would like to speak about before we wrap up? Because it's very difficult to answer every single question in the chat box because of time. In the absence of that, so if you do, please raise your hands up.
Okay.
Yes.
Please, how long are we to go through all those symptoms for? Is it 5 years? Is it 10 years? Until they all stop and go away?
Okay. I can answer that. So it varies. That's the truth. It varies from woman to woman. So in some cases, they say that, well, research rather shows that it can go on for 10 years in some women 12 years. In some women is less than that. So it's really difficult for us to say, because it's not one size fits all. So yes, it varies from each person.
Thank you so much. Thank you so much, Dr. Anu. Thank you so much for Dr. Rametu. This was very, very, very insightful. I'm sure everyone who joined can testify to that. It was very insightful for me. I'm not even close to menopause yet, but, I've learned a lot, the symptoms, what to do. I've learned a lot from the pharmaceutical point of view, and then as I mentioned, new information about HRT as well. And thank you so much for answering the questions. Someone is asking again about supplements we need in a nutshell. So we already mentioned magnesium, black cohosh, primrose oil, vitamin D supplements as well. And we would also encourage, because menopause is, as they mentioned the importance of regular health screenings around menopausal age. You tend to have increased cholesterol levels, high blood sugar levels around this age. There's the cardiovascular impact as well on your heart. So I want to encourage you to please ensure you get your regular health screenings every year. Also, as you grow older, your risk for, things like breast cancer, endometrial cancer increases as well. So please, get your regular health screenings as well. And, your lifestyle and diet as well is also very important. Get your exercise in, get your diet in. And that way you'll be able to stay on top of menopause, and, it would make your menopausal years easier for you to navigate. So in the absence of further questions, thank you so much for joining. This is our community, this QR code. You can join our community using this QR code. So you just need to scan with your phone and it will take you straight to our community. So that way you can continue the conversation about menopause. You can, join a community where you can receive support, any support you need, and also speak to other women who are going through this. So I'm going to go on to call our admin manager, so Joy Mwakwo, to just wrap this webinar up for us. So Joy, over to you.
Hello, everyone. Thank you so much for joining the session this afternoon. I hope you all had an amazing time listening to our speakers and learning more about menopause. My name is Joy Wanko. Thank you so much, Dr. Taiba. Thank you so much, Dr. Ramatu. Thank you so much, Dr. Anu, for such an insightful section this afternoon. So thank you to all the women who joined today, and apologies to the man who we took out of the group. It's a women's only event. Sincere apologies for that. And we'll do well to communicate better next time so everyone knows that when our webinars are women only. So you have the barcode on the screen showing. So you could just scan with your mobile devices to join our community. At Debo, we are building a community of women like you and like me. We know that one of the things that help women navigate through the phases of our life is community and support. So we are providing that support to as many women that we can reach. So do well to join our support group. At Depot 2, we run a wide range of laboratory services. I'm sure if you listened very well during this session, you must have heard some laboratory testing that you need to do. Check your cortisol level, check your vitamin D level, calcium level, hormone levels. These are services that we offer here at Debo. And some of you might be asking, oh, meal plan, how do I get to know what kind of meals to take? We have very outstanding dietitian, nutritionists at Debo Africa. Do well to consult us to book a session so you get to speak with a dietitian and curate a meal plan just for you. You'd agree with me that every woman is different, right? So you don't want to take on one advice as a one size fits all. You want to get a personalized meal plan or a personalized treatment plan for you, something that works for you, and you know that, oh, this treatment is personalized for me. Also, we offer a wide range of virtual consultations, ranging from gynecologist, neurologist, endocrinologist, rheumatology. You get to meet chemical pathologists, hematologists for your virtual consultations. We know that commuting to hospitals when you don't necessarily need to can be difficult for women. So at Zebo, we're bringing the healthcare that you deserve closer to you and making it more accessible to women. So if you want to know more of the services that we offer, you could go to our website, www.debo.africa, to learn more about us, book for a session, to speak with a doctor, to speak with any of our consultants today. So thank you so much for your time. Thank you so much for spending your beautiful Saturday morning with us. We really appreciate your presence and your audience. Thank you so much. Over to you, Dr. T.
Okay, thank you so much, everyone. And for those asking if we're going to share, so we'll just share the link in the chat box so you can find the slides there. And if you have any other questions, please do well to join our WhatsApp community and we'll answer your questions there. So have a very nice weekend, everyone. Bye.
Thank you. Bye.